I am going to discuss a topic, hospital and its organization, from the subject Pharmacy Practice BP 703. So today's video we will be discussing regarding the several topics like introduction of hospitals, a small brief introduction, then history of hospitals, how hospitals, that is modern medicine, or how the modern hospitals, super specialty hospitals has came. So what is its history basically, then definition of hospitals, classification, organizational structure, and what are the functions of hospitals. So before going with the organizational structures or deep matter, let us have a small introduction regarding hospitals. As you all know, hospitals are more important pillar of any societies. That is basically the hospitals, they are the physical executions, they exhibit the physical execution of one of the pillars that forms the infrastructure of a nation in form of healthcare. So the word hospital is derived from the Latin word hospitalis, which in turn derived from the French word hospice, that means a host or a guest. So a hospital, as a definition, you can also write the hospital is a healthcare institution providing treatment to patients with specialized staff as well as equipment. So basically it is an healthcare institution. That is a major word you have to note down. It is an healthcare institution. It provides treatment to patient with whom specialized staff as well as specialized equipments will be there in the hospitals. So hospitals are institutions which are mainly designed for care for the sick, injured, as well as for the wellness of the patients. Now next we can see regarding the history of the hospitals. So basically hospitals was established from the archaeology section of Hindus. So basically temples will be there. So temples, besides the temples, in ancient times the doctors came forward for treating the patients. So they were given a small piece of land, especially like paddy fields, they were given to those doctors, and those doctors treated the diseases like fever, asthma, piles, jaundice, etc. Then later onwards, other systems like Ayurveda, Siddha, Unani, homeopathic types were also adopted by these doctors, and a process known as hakims. So these hakims, they used to visit the villages and patients at their homes. Then when the centuries passed, this medical field has been advanced in both the science as well as in the technology, in the diagnostic as well as in the surgical area, which build up the confidence to render better service to the community to ensure and good health. So this is how the emergence of hospitals has been came. So as a pharmacist, we will be much familiar with the term hospitals, but as a professionals we should be able to define an hospital. So a hospital can be defined as an integral part of a social and medical organizations which helps to provide a complete healthcare, both curative and preventive, as well as outpatient services such as OPDs, outpatient services, so that it can reach out to the family and its home environment. So basically the hospital is an integral part of a social and medical organizations which provide curative as well as preventive health care, as well as the outpatient services that is necessity, if it is necessity for the patients. Rather than this, the hospital is also a center for training of health worker and for biosocial researchers. That is both the training process that is the hospitals give training programs to all the medical staffs in a hospital, that is training programs to nurses, training programs to pharmacists, training programs to doctors even. It will be provided. Along with that, all the research works, bio research works is also going in the hospitals. So as per the next we are going to see the classification of hospitals. There are number of criteria by which the hospitals can be classified. So among that criteria, the main two divisions are clinical and non-clinical. So basically on clinical basis we can again classify the hospitals on clinical basis like the types based on the type of disease, such as you will be able to see TB hospital, that is which mainly helps to treat only the TB patients. Then mental hospitals, that is mental distorted peoples will be coming, the patients will be coming there for the treatment purposes. Leprosy hospitals. So these based upon the disease the hospitals will be classified. Then that is on the type of disease. Then again in the clinical basis based upon the patients, that is based on the gynecology department, that is only those patients will be coming there for the treatment purpose. So that is another category, that is type of patients. Then again there is types of medicine. So based upon the medicine, whether it is an allopathic hospital, Ayurvedic hospital, homeopathy, so based on that also the classification is going on. And types of organ, that is such as ENT hospital, eye hospital, ortho hospital. So like that based on the clinical aspects the hospitals is classified. Then other than that and a big example is AIIMS hospital at New Delhi, which provides all the clinical services to the patients. Next is on basis of non-clinical, that is on the basis of ownership, then basis of the cost, then basis of the bed size, that will be seeing in the coming slides. So first again one more classification on the, I have told there are several other criteria for the classification. So another criteria is based on the objective. So objective, this will be much more familiar to you, like general hospitals, that is district hospital, etc. General hospitals, special hospital, I have already mentioned, that is TB hospital, TB hospital, mental hospital. So like that special hospitals. Then teaching cum research hospital. In the teaching cum research hospital, as I have said, AIIMS is the best example in teaching cum research hospital. So this is on the classification based on the objective. Next is the classification based on administrative, ownership, control or financial income. So based on this, that is administration, their ownership, control and finance, the hospitals are being classified into government, non-government or private, semi-government hospitals or voluntary agency hospitals, or it also known as charitable hospitals, that is charitable. So it can be a voluntary or a charitable hospitals. So this is the classification is based on the administration, ownership, control or financial income. So the next classification is based on the length of stay, that is whether it is short term or long term. So short term means it is basically considered to be as less than 30 days. It is considered to be as a short term stay hospitals, and if it is more than 30 days it is considered to be as long stay hospitals. Then next one is based on the type of the medical staff present, that is closed staff hospital and open staff hospital. In closed staff hospital only limited number of staff will be provided. Just when you go for the primary healthcare centers and all, it will be somewhat like one pharmacist, one or two pharmacists, of course one doctor, like that. So such preliminary treatment strategies will be followed there. In open staff hospital it was some more equipped with the medical staff as well as with the equipments. The next criteria is based on the bed capacity. So based on the bed capacity, the hospitals are classified into small, medium and large. So basically the small hospitals means it will be having a bed up to 100. If it is medium hospitals, the bed strength will be less than 300 beds will be there, that is in between 100 and 300, but it will be less than 300. In large hospitals the bed number should be more than 300. Then next is on the based of type of care. So based on type of care it is classified into mainly three types: primary, secondary and tertiary. Then based on the teaching affiliation, the hospitals are being classified into two types: teaching as well as non-teaching hospitals. Then based on the system of medicine, I have already discussed regarding this, that is based on the system of medicine, again the hospitals are being classified into allopathic, Ayurvedic, homeopathic, Unani and hospitals of other system of medicine. So I have already said regarding the primary health center, so much more you will be much more familiar with the primary healthcare centers. So this is the first level of contact between the recipient of care and healthcare delivery system. So the first level of healthcare providing a facility is a primary healthcare centers. So majority of the problems that the patients are facing will be resolved in this primary healthcare centers. And this I have already said, the primary healthcare centers or healthcare services, they will be having a limited number of staff, but majority of the patient's problems will be assisted, and proper guidance will be given by the healthcare workers. So in rural areas, these services are given by means of sub-centers, primary health centers, and even the community health centers. So in rural areas, these are the three important primary healthcare centers, such as sub-centers, primary healthcare centers, or community health center. Next is secondary level healthcare. In this level, some more complex problems are taken to consideration. That is, those problems which could not be resolved by a primary healthcare center will be referred into a secondary level healthcare. So it will be given some more consideration, that is such as preventive services, curative services will be provided by this secondary healthcare centers, and this will be mainly the district healthcare, that is district hospitals, state hospital, district hospitals, etc. comes under the secondary level healthcare centers. And those cases which could not be handled by a primary healthcare center or a community healthcare center will be referred to a district healthcare centers or the secondary healthcare center. Next, we are going to discuss regarding the tertiary level healthcare centers. So this healthcare center means it will be a state or regional or central level institutions. So this healthcare is provided by a state, regional, or central level institutions. These institutions serve as a referral units for primary and secondary levels. That is, those cases which could not be treated under the primary or secondary care centers will be referred to a tertiary level healthcare centers, which will be, that means basically super specialty, multi-specialty hospitals, etc. come under the tertiary level healthcare services, because the number of staff, that is immediate concern for the patient, will be obtained in the tertiary level healthcare centers. Besides all the services, this institution can also provide education as well as training for various categories of healthcare. That is, especially in case of multi-specialty, super specialty hospitals, they will be providing training to all the staffs that has been working there. In every department, in every staff is mandatory for going for the training programs, or some continue education programs will be given for them, just for acquiring the knowledges.